The voices of Indigenous children, parents, and service providers aren't sufficiently taken into account when they enter the youth protection system. This is one of the conclusions in the Quebec ombudsman's report. He says there have been some significant improvements following the Viens Commission on improving public services for Indigenous communities, but there's still work to be done.
Loin de leur famille et de leur communauté.
Some of the ongoing problems: children placed in foster homes, far from their families, communities, and cultural heritage for months, kids in rehabilitation centers being deprived access to education because of language barriers.
Voire parfois un non-respect.
He also noted a lack of knowledge and sometimes a disregarding of Indigenous governance and expertise. This isn't a surprise for the organization that defends the interests of First Nations in health and social services.
Even when we're invited to the table and we're listened, we're asked to share what some of the challenges are or what recommendations you have, those recommendations aren't taken into account or they're not implemented.
This is Dowd's second update following the 142 calls to action issued after the Viens Commission. The province's ombudsman makes 6 recommendations to Santé Québec, the Health Ministry, and the National Director of Youth Protection to improve the situation.
A concrete example is when we're making a referral. So if we're making a referral to a Centre d'Amitié Autochtone, and we're wanting them to provide services to the parents, and we say they need help with parental capacity. Well, parental capacity is very vague.
The other recommendations focus largely on collaboration between the health network and Indigenous organizations and ensuring better access to services. The Health Ministry tells CBC it's working on 2 action plans for the network, which will take the recommendations from the Viens Commission into account.